Hi, my name is Lani Gerandoy Portuguez, and I am the auntie mommy of Janelle May Gerandoy JUNCO. She asked me if I could help her with her project and asked me if I could take a video of myself and talk about their concept, my life as a nurse. And because I cannot say no to my niece, I had to give in to her request. And so, let's start with the question why I wanted to become a nurse. I wanted to become a nurse because I love nursing and I love to take care of the sick people. I started my nursing career at the age of 21 in the early 80s, where I was assigned in different areas of our local private hospital. The first 2 years, I was assigned in the medical surgical ward, and the next 2 years in the pediatrics and OB/GYN ward, and the last couple of years, I was assigned in the emergency room department. Each area, each department has different challenge. Each area and each department has a different kind of unique experience for me. My skills in total nursing care, bedside procedures, assessment and evaluation, critical thinking, decision making are all honed and polished in that area. So I was very thankful that I was assigned in those different areas in our hospital because it helped me a lot in pursuing my nursing profession. Then they promoted me to a position of chief nurse. At first, I was apprehensive because I was still young. I was still 27 and considered to be one of the youngest. Grabbed the opportunity and accepted the position as chief nurse, and I stayed there for 13 years. And with those long years, my skills in leadership and management was honed and polished. I was also one of the responsible people in hiring staff. And one of my functions as a chief nurse is to collaborate with all the nursing department and with all the hospital department in the area. But that doesn't stop me from aiming high. So I applied to another country, and luckily I was accepted as one of the staff nurse in Al Fanatier Hospital in the Kingdom of Saudi Arabia, where I stayed there for 2 years, one contract. Working in a different country like Saudi Arabia, where the culture, the tradition, and the language is a big challenge for me. Taking care of patients that do not speak my language, I had to study Arabic so that I can communicate with them. And so, after 2 months of studying Arabic, I was able to communicate well, not only to my patients but also to my colleagues and other staff in the hospital. I stayed there for 2 years, and then when I went back to the Philippines, again, I did not stop pursuing another field. And so I applied as a clinical instructor in Colegio de San Agustin in Bacolod. And I stayed there for 6 years. And in those 6 years, I finished my Master of Arts in Nursing, major in maternal and child nursing in the University of San Agustin in Iloilo in 2007. It was a very fulfilling experience for me because teaching students both in the classroom and in the clinical area is very, very fulfilling feeling of a clinical instructor. I enjoyed my stay in Colegio de San Agustin for 6 years, and until now, my students are still communicating with me. So I did not stop again as an educator. I did not limit myself as a clinical instructor. So I applied in another opportunity, an opportunity in applying for Canada. So when I was issued an immigrant visa with my family in 2010, we came here. But if somebody will ask me again what profession would I like, I still answer him or her that I wanted to become a nurse. On the lighter side of nursing, although there are downs, let me tackle first the downside of the nursing. First is the patient's acuity. Especially in the Philippines, we're only one nurse with many patients, like one nurse is to 20, one nurse is to 30 or 40 patients. How could you give quality care to those patients and you are alone as a nurse? Even if you have nursing aides, even if you have the utility, still it is not enough. So that is one downside of nursing. And then another one, which cannot be denied, especially in the Philippines, is our low salary grade. That is really, really true. And that is one of the challenges that the nursing profession is facing now in the Philippines. But that is part of nursing. That is part of the experience. If you wanted to grow more professionally, there are lots and lots of opportunities outside the country. So that is the lighter side of nursing. That is the up in nursing, wherein it offers the plenty of choices in the areas that suits your lifestyle. Then there are lots and endless opportunities and demands abroad. And if you wanted to collaborate with the partnership in working with other professions, there are also lots of opportunities in that field. So it's not bad. There are ups and there are downs, but it's more on the lighter side of it. You know, nursing is calling. It's not just a profession. It's not just a career, but it's also a calling. And if you really love nursing, just like me, wherever you are assigned, whatever areas you will be, you are still happy because you serve. You are still happy because you are there for those people who needed your help. And just enjoy. I mean, there are lots of things to smile about in nursing, especially when your clients will say, "Oh, thank you so much, Nurse Lani. Thank you for helping me." Oh, that's a very, very fulfilling feeling for me. So that's why I'm glad that my niece is taking up nursing, because it's really a very, very noble profession. It is a very a very awesome profession. And overall, nursing is really the best profession for me. And before I end this video, let me tell you about the meaning of Lani, Lani, and it is learning and nursing is interesting. Thank you.